So most people with OP will understand that glute dysfunction is part of what's wrong with their body. But how they try to address that problem and how they understand that is really problematic. So I want to just clear that up in this video. So firstly, the glute muscles are a really interesting complex of muscles. So glute max is the one that most people think about. It's the one that provides the power to do something like a squat, or when you're running and your foot hits the ground, it's the one that pushes your leg behind you to create power when you're moving. But it's really only part of the story. There's a whole set of muscles underneath that, which are called the hip stabilizers. And these muscles' job is to suck the hip into the socket. So they attach to there and they suck the hip into the sockets, and that provides a lot of stability to the hip joint. Now, the problem with OP is not an issue of power from glute max. So things like glute bridges and even clams to a degree aren't going to address this function, because they're going to address muscles like the glute max and the glute med. They're not going to get these deep hip stabilizers, and they are the ones that are problematic with OP. Now, in OP, the issue is that those hip stabilizers don't function effectively, and notice I use the word, they're not weak, they just don't function effectively and efficiently. So they don't stabilize and provide stability at the hip joint well enough. So then what your body is going to do is it's going to start recruiting your adductors, which are these broad muscles that are attaching here, that can suck the hip into the socket from the inside. So they're going to try to suck this hip into the socket by pulling in this direction through here. The problem is that that's just not a great position. This is a much better muscle to do that with, but if you try recruiting this, they're going to fatigue and they're going to overwork, because they're compensating for the ineffectiveness of these glute hip stabilizers. So they'll get overworked, and then they'll start to become symptomatic, which is one of the more common symptoms of OP, right? Adductor tension and pain. The lower core as well, attaching through here, it controls the whole pelvis. So if you can't stabilize the hip by sucking it into the socket, what you might try to do is stabilize the entire pelvis to compensate for that. And so that's one of the more common symptoms that you see with people around this inguinal area within hernias, and with that just lower core pain and dysfunction that you experience. Again, compensating for the hip stabilizers not functioning. Now, the key thing that people don't understand when they start trying to deal with these issues with the glutes is that they start to go, well, the glutes must just be weak, the glutes hip stabilizers, the glute max must be weak, I need to make it stronger, more clams, more bridges, more weight, kind of things. And strength is important, but the problem here is not that they don't have strength and they're not strong enough. The problem is that they don't function efficiently and effectively. So these deep hip stabilizers, they live within a fascial chain called the deep front line. And that chain connects you from the arch of your foot all the way up to the top of your neck, and it goes right through your deep core. So ideally, the way this chain functions is that when you're doing an exercise, you're doing a movement, your foot and your core will communicate to your hip stabilizers, and this entire chain will tell each other what to do. So if I'm doing a squat and my chest is coming down, my core here, up here, and my feet here will tell the hip stabilizer exactly how much to fire to help keep this entire chain stable. So it's not going to fire really hard, but it's going to fire really efficiently in conjunction with this entire chain, so you're distributing load across your entire body. And the issue with most OP patients is that their feet don't function effectively, or their core, deep core, doesn't function effectively in communicating across this entire chain. And a lot of the biomechanical tests that I have you do will highlight this in detail. So when they go down to this squat, the hip flexors can't function, this hip stabilizers can't activate effectively. So from my perspective, I'm not so interested in how much power you can create from your glutes. I'm more interested in what happens when your foot hits the ground on foot strike. Does your foot tell your hip stabilizers how to function to keep that hip stable and take pressure away from your adductors? When you are holding an object and you're walking through space, or you're trying to push someone on a field or something like that, is your deep core and your arms communicating effectively with those hip stabilizers, allowing your lower core to not have to work as much because the hip stabilizers are working more efficiently? So most of the glute dysfunction that you are dealing with, it has more to do with this lack of coordination across your entire body. So when you are trying to address this glute dysfunction, you need to be thinking in a broader, global way, rather than just my glutes are weak, I need to make them stronger, kind of thing. Now, obviously within my program, I do that with people and I take people through that. But things like yoga, how to address this in certain ways, and this is certainly a hell of a lot closer than just doing 100 bridges and 100 clams. So I just strongly encourage you, when you're dealing with things like your glutes, when you're dealing with any weakness in OP, try to think more globally, try to think across your body, try to think more in terms of efficiency and coordination rather than weakness and lack of strength. Because that is just the traditional model for treating injuries. And if you're watching this video, that traditional model probably hasn't worked for you. So start thinking differently, start approaching this differently, and you might start to get some different results. So I've been treating OP exclusively over Zoom and Skype for the last 8 years. Trust me when I say I know what you're going through, because I've been through it with over 1,000 other OP patients who are sitting in the exact same situation you're sitting in right now. Confused, annoyed, desperately just trying to figure out why you have this condition and what you need to do in order to get better. So I'd really recommend booking in for an initial consult with me. I charge a fraction of the cost that I would for a full consult. I'll assess you, I'll look at your movement patterns, I'll give you a good idea as to why you have this condition and some of the broad steps that you'd be taking with me if you were going to get better from it. And so even if you decide that I'm not the therapist that you want to go with, you'll be armed with the kind of information to make better decisions about the type of therapies and the type of therapists that you'd want to engage with in order to make sure you get better permanently.